Okay, hello, healthy people. Today we're gonna be talking about UTI. So, as you can see on the board, um, we have UTI. The meaning of UTI is a urinary tract infection. Urinary tract infection. So basically, it's an infection that occur in the urinary tract. So your urinary tract comprises the urethra. From the urethra, it goes to the bladder. From the bladder, we have the ureter. Then the kidneys, we have two kidneys. So those organ or those structures can get infected, especially the bladder. So because urine stays in the bladder before it goes through the urethra when we want to void. Okay, so you can see here I put it down, women at greater risk. The reason of that is because women has a short urethra. Okay, and that's an NCLEX question for those that take NCLEX exam. They might ask you, why is women more susceptible to having urinary tract infection? Is because of their short urethra. So that is why they are more susceptible. Okay, now we have the signs and symptoms of UTI. All right, the first one is urgency. Urgency is when you're having extreme tendency that you have to urinate. It's like you have that urgency, the urge, a strong urge that you have to go to empty your bladder. So that's urgency. So that's why it could be a sign of UTI. Okay, if you have a cloudy urine, if your urine is cloudy, okay, you know the normal color of urine. If your urine is cloudy, that might be a sign that there's an infection going on. Okay, let me just go back. The most common infection that affect the urinary tract, it could be E. coli. It's a form of bacteria. It could be E. coli, but there's some other bacteria that can also affect the urinary tract. But the most common one, I think, is E. coli. Okay, so the urine can be cloudy. All right. The normal color of urine is amber color, amber. So if you are seeing a cloudy urine, so that should be a form of red flag for UTI. Okay. Now, if you are passing small amount of urine, like when you go to the bathroom, you want to void, you find that you are going, if it feels like you want to empty your bladder but you couldn't do it, it's just like you are dribbling. So that could be a sign of UTI as well. If you have a strong smell from your urine, if your urine has a, you know the normal color of urine, the normal smell of urine, excuse me. So if you have a strong odor coming from your urine, that can be a sign of UTI as well. Then we have hematuria. Yes, hematuria means blood in your urine. If you're having blood in your urine, that could also be a sign of UTI. Okay. Now, we have fever here. Fever is when you start to have high temperature. So when you start to have high temperature, that means it starts to involve a kind of systemic reaction. It might be going to like sepsis, like it's the body is responding to bacteria that is in your urinary tract. So that could cause fever as well. Okay, it's a form of a response to the bacteria. Okay, and it can also be a sign of sepsis. Actually, it's called urosepsis. That is, sepsis is the body response to bacterial infection. So when you say urosepsis, that means it comes from the urinary tract. So it could result to fever. Then we have the pelvic pain. Pelvic pain is common in women. So especially in women, they start having pain in their pelvic area. All right. Now, so the most important part is what can we do to prevent UTI? So what to do? So let me put a question mark here. What can we do to prevent UTI? So the first thing we should do, try to empty your bladder quickly or frequently. So we have a lot of people when they are at work, especially if their job is so demanding, they can hardly use a restroom. So they just keep the urine in the bladder for too long. So that could be they can be more susceptible to develop UTI. So you have to have the habit of empty your bladder frequently. I mean, don't stay too long before you actually empty your bladder. Okay, so it's very important to empty your bladder as soon as you're having the urge. Don't hold on to your urine. Okay, then the other part is to drink water. Water is very important because when you drink water, you're able to flush your urinary tract, you flush the kidney, you flush the urethra, you flush the bladder, you flush the ureter and urethra. Okay, so if you look at here, these structures tells you how the kidney, this represent the kidney. Kidney is more like a bean size organ located at the posterior part of the body at the back. Okay, so we have the ureter here. This is ureter. This guy here. This what is ureter. So ureter takes urine from the kidney and dump into the bladder. This is the bladder, right? This is the bladder right here. So when the bladder is full, not necessarily full, but there is a muscle here that open up when the bladder is in that has certain amount of urine here. So you feel the urge that you want to void. So the urine goes through the urethra. The urethra is the meatus. The meatus is the structure that takes urine from the bladder to the outside part of the body. For female, the urethra is shorter, but for male is even longer. The male urethra is longer than that of a female. So that is why women are more susceptible to develop a UTI. Okay. All right. So let's go back to drinking of water. It's not like you have to drink 8 ounces. 8 ounces is like 240 ml. That's a cup. 1 cup of water. At least you do 8 cups. Okay, 1 cup is like 8 ounces. So you drink it throughout the day. It's not like you drink 8 cups just at a time, because if you do that, what happens is that your body will just flush out the urine and the water from your system right away. So you drink it throughout the course of the day. Okay, so water is very important. It also helps the kidney to function properly. If you're not drinking enough water, we are compromising the function of the kidney. Okay, the kidney needs water to function adequately, and it also flushes toxins out of the body, and it flushes out bacteria that might find themselves in the urethra. It flushes them out so they don't colonize the bladder, because that's what we don't want. We don't want the bladder to be colonized with bacteria. Okay, so the other point I have here is the cranberry juice may also help. Cranberry juice also help to prevent UTI. So, but there's a lot of question mark about that. How much cranberry juice you have to drink? So some people say it's better to get um, the 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 tablets or the capsule from the pharmacy instead of drinking the whole juice, because you don't want to take too much sugar as well. So I put a question mark, but maybe you should get the tablet instead. So I'll just put a tablet, cranberry tablet. Maybe that will work better, because you don't want to introduce too much sugar to your system by getting the juice. But cranberry help in preventing urinary tract infection. Now, the other parts, especially for female, make sure you empty your bladder, okay, before and after sex. It's very important. So before you have sexual intercourse with your partner, try to empty your bladder. Empty your bladder is very important. So that helps the bladder to stay empty, so it doesn't create a kind of environment for bacteria to flourish. So try and practice that. Try to make that a practice to empty your bladder before and after sex. That might also help to prevent UTI. Okay. Now, when you have UTI, okay, what do you have to do? First of all, you have to speak to your doctor. Of course, I'm not a doctor, but you speak to your doctor. They can run tests. To when you have all these symptoms, they can run tests, which is called the UA and CNS. So this is a urinary analysis, and this is culture and sensitivity. So what that means is that the urine can be analyzed to see if there is any abnormality that can suggest infection going on. So if that is done, they can use a broad spectrum antibiotic, to treat the infection, or they can do what is culture and sensitivity. So that will tell you the antibiotic that will be effective in killing or controlling or treating the infection, because we have different type of organism that causes UTI. So they will run the urine, they culture it, and they see the sensitivity of those medication, the sensitivity of those bacteria to the medication that might be effective in treating UTI. So they run this test. So there's different type of antibiotics. As I've said, you speak to your doctor to see which antibiotic might be effective in taking care of the infection. Okay, so that's what I have for you today. I hope you enjoy the little education about UTI. So join me some other time when I have another interesting topic to discuss. Until then, stay blessed.